Joe Clinton. Oh. So Joe would say something, Joe and Mark would say something about function. You want to tie it back to function. So say my patient is between 65 and 90 years old. So I am actually going to put down okay, so I know that's kind of small, but what that says, sit to stand from toilet seat 2 times 20. So now Todd comes in, he comes into the home, he knows I'm working, I'm doing home health. Patient went into the bathroom, sat down in our toilet seat, which can be low, and Pat did 2 sets of 20 reps. So now Medicare is going to look at this, and in 95% of the time it's a nurse who is reviewing the note. And the nurse is the one that's going to have to say, okay, well, that muscle, working the quads and the hips. If the nurse is going to say that's not functional, then we have to defend ourselves saying, well, that clearly works those muscle groups. Now the occupation is an electrician, okay? So now you're going to put this, you're going to put okay, so now I'm gonna write. I'm not gonna put this. I'm gonna write something different. Step up, step down on 8-inch stool block, 3 times 15. So now in a person's home, they have a step stool probably somewhere. They have stairs. They have steps. If they don't, then you can bring in like the little aerobics thing or a step stool. Most everybody has something where you can work. Or the distance or the height from the living room when they step down onto their lanai is about 8. So if you have 1 foot up, 1 foot down, and you're doing that exercise, in any event, you're still working the quads, the hips, you're working the same muscle group. Now I'm going to go to this athlete. So now I have a person who, say they play soccer or they're a pitcher. So they're a throwing athlete. So everybody knows where do you get your power from throwing? The hip and the core, so you got to have really strong. So I might put down side lying hip abduction, prone hip extension, maybe even a long arc quad with 5 pounds, 3 times 12. So again, I'm working the same muscle group, but I'm working in an open chain in a little different manner. But when you look at it, it's the same muscles, but my note is totally different. So I mean, in the retired Medicare, I'm making it more about functional, washing hair, doing dishes, getting up and down from a toilet seat, stepping into a bathtub, things like that. Does that make sense? Okay, and you could apply this to upper extremity, lower extremity, however you want. My opinion. So somebody give me their opinion on. Let's say we're working with the. Let's say the volleyball player has really overdeveloped delts and pecs, and they're really strong in their upper body, but they're not very strong in their lower body. So everybody should know this biomechanically. If you go to serve, or if you pitch or you throw, if you do anything with this kind of motion, the stronger hip and core muscles you have, the less force you're going to have to use your arm. But if you're weak down here, and you still want to generate a strong serve or a kill or a pitch or whatever, you're going to overuse your upper body, and you can get overuse injury. So now we're working on the muscles down here for the core and the proximal hip to improve stability, proximal stability before the distal mobility. So what would I put for an assessment? Patient was able to do that, but he had some difficulty. So Mark, give me an opinion of maybe why he had difficulty doing 3 times 12 of the side lying hip abduction and the prone hip extension. So if he's using 5 pounds, weakness where?
Glute med for everything.
Okay, so he had trouble doing 12 reps. Secondary to weakness in his glute med. Okay. And Devon, give me another sentence.
Difficulty forming hip extension.
So what's the other factor? You could say he had weakness.
Tight hip flexor.
I'm going to give you a clue. He had weakness doing sideline hip abduction with 5 pounds, so his muscle and his glutes were not strong enough to overcome that pound resistance. What else was another factor in this exercise? Gravity. So you could put fatigued early in muscle due to gravity. So I'm given a reason why the person couldn't do it. So this is where the assessment comes in, is you're saying, we know they couldn't complete that, they had a hard time, why? So now, DeMarco, knowing this information, you're the therapist who comes in the next visit, and you still want to work on that muscle group, what's the 2 things you're going to do right away? And you might even lower the resistance for sure, and maybe change position. So that's the way you want to think of it, okay? All right, good. All right, so now, Tracy, tell me the reason why this person struggled to do 3 sets of 15 with the step up and step down. So what's the variables? The height of the stool, and what else? Muscle physiology. Think about what happens when you step up and when you lower. So difficulty with step ups due to step height. Okay. What's that? It's not enough.
What means stability?
You have to give me another qualifier about the weakness in the quads.
Could be tight.
How do the quads contract? Okay. So when you step up, the quad is acting how?
Concentric.
And when you lower?
Eccentric.
So say the difficulties with lowering. So you're gonna specifically say pour eccentric or eccentric rotola the quad and hips. Now, you know, Derek's probably saying this, you know, well, am I really going to write all this stuff? Do I really have to write all this? And my answer to that is, when you get your license, you can do whatever you want. You can write however you want. Some clinics are not going to care. They're going to say, just see 15 patients a day, make us $300,000, which you are, and we'll flip you back 60 grand for a salary. And if we get audited, we made so much money that we'll pay the fine. That's the nitty gritty business of it. That's what they do. Other clinics that are smaller, that don't have enough money, they're going to get their clinicians. No, you're going to learn how to write good, quick soap notes. You're going to put the proper defensible documentation in there, and that's going to be that. So, a couple different ways to look at it.
For the assessment, could you also add say your patient will not tactile cues and stuff like that?
Yeah, you could say, or you could say, increased self-confidence and performance. Secondary to, yeah, you could secondary could decrease cues. Okay, or if you're really doing this a lot, you're thinking about it, you could put decreased cues and transition from cognitive to associative stage. The neural therapists, when you're working like a Health South, a rehab center with a lot of neural, they're writing those kind of words more so than the orthopedic outpatient setting. But you are clearly showing a progression. The patient leaves less cognitive cues because they understand it now. Now they're more in the associative phase, so they're actually performing it. Then you think about what kind of errors are they making. Down here, Mallory, what's the problem with the home care? The person is getting down from the toilet seat, and they struggled with 2 times 20. They're having a hard time. So you want to tell Sherry that for her next visit, the patient had a difficult time, and you want to explain to her why you think they did.
It's gotta be eccentric.
Combined with the low toilet seat, we're gonna get up. Oh yeah,
I'll get down.
Okay, so the low toilet seat. What else? The toilet seat. There was nothing to hold on to. So no grab bars. Now, what if the person does this? They hold on to the bowl or the toilet, and they have one arm on the sink and they push up like that. That's how most people do it, right? But what if you witness that and they do that, and then all of a sudden they fall one time and crack their head? Who do you think's liable? Well, you knew about it. So yeah, so you can put in the plan. We'll discuss with DME company about ordering grab bars. We'll discuss with supervisor about possibly ordering grab bars. So now you've covered yourself.
Could teach them how to stand up more properly.
Or you can play the plan. We'll practice from kitchen table chair, which is higher than the toilet seat, with one arm to push up.
Also, we could recommend those like toilet extenders that you put on toilet seat.
Yes, you can. Yeah. All right. So you guys getting a better picture of how to tie it back to some kind of function.
Yeah.
All right. Soap note is hard. It's a hard deal. I'm telling you. I could be the best clinician in the world. You guys can be the best clinician. You can be the best hands-on therapist. But if you can't translate what you do to the computer so someone can read it, they're going to say, I don't know what the heck you do. You may be great, but I can't read what you done. I have no idea. And then there's mediocre therapists who write so good, they know how to write, and they can make themselves sound on paper a lot better than when they really put their hands on the patient. So you're going to see that disparity. All right, any questions on that?
I stop it.
Yes. Okay.